Good day, everyone. Thank you for giving me this opportunity and this platform. My name is Omuchineke Ugochukwu, and I'm presenting for the team Next Gen Minds. So today, I'm excited to share a practical, scalable solution designed to tackle a serious and persistent challenge in Nigeria, which is the access to quality healthcare in rural communities. So the solution we propose is called Mobile Health Boot, a project born out of first-hand insight, user research, and a drive for equity in healthcare access. Today, I'll walk you through the background of the problem, the rationale behind it, and I believe it's worthy of your support and funding. So I'm going to be defining the problem for you in the next few minutes. I'll introduce the idea. Let's take a moment to understand the problem we are trying to solve and why it really matters. Millions of Nigerians face life-threatening delays due to lack of nearby affordable healthcare. In many rural and underserved communities, something as simple as fever, a minor headache, a pregnancy complication, or even a minor injury can turn deadly, not because help doesn't exist, don't get it wrong, but because most times these medical centers are quite out of reach, are far, or it's too expensive. Now, this issue ties directly to one of the world's most pressing global challenges and opportunities, which is universal access to healthcare. The United Nations identified this as a key pillar in achieving health equity worldwide. If we can solve this locally, we are contributing to a global solution. Firstly, the major reason why this issue is critical and we need to solve it on time, we need to prefer a good solution, which I will be presenting to you in the long run in the course of this presentation. Because of the inequitable access, which leads to deaths, which could be prevented. These losses could have been avoided if the right systems are in place. Secondly, when people are sick or lose family members, they often fall deeper into poverty, spending their little income on travel, traditional medicine, or late treatment. Thirdly, the ripple effect is a weakened national development, less productivity, more strain on the economy, and rising public health costs. So this isn't just a health issue. It is a social and economic one, and solving it could unlock healthier lives and stronger communities. So let me introduce you to Grace. Grace is a 32-year-old cassava farmer living in a remote village in Benue, right? If you can see on my screen, you can see that this is a picture of Grace, and she experienced severe abdominal pain, but had no access to a nearby health facility. She eventually traveled over 20 kilometers to get help. So by the time she saw a doctor, her condition had already worsened. She was diagnosed with a ruptured ovarian cyst, which could have been avoided earlier with timely medical as advice, right? So Grace represents millions of Nigerians whose health are jeopardized by distance, cost, and poor healthcare infrastructure. According to World Bank in 2023, approximately 45.72% of Nigerians live in rural areas with poor healthcare facilities and poor healthcare access, long distances, and high transport costs, few professionals, and high morbidity from preventable diseases. This has continuously become the story. People often travel long distance to reach health centers, incurring high cost of transportation and long wait times.